Thank you very much for waiting. We are going to have a next session, special lecture. The speaker is Jacqueline Kitulu, the president of the World Medical Association. Dr. Kitulu continued to be practice medicine at the hospital in Nairobi, Kenya. She has held numerous prominent positions, including becoming the first female president of the Kenya Medical Association, and has made a significant contribution to the development of Kenya's healthcare system, for which she has received multiple honors. Within the World Medical Association, she has played an influential role in advancing digital health, as well as working internationally to strengthen medical ethics and the professional independence of physicians. Today, she will deliver a lecture titled Building a Healthy and a Safer Future by Integrating Human, Animal, and Environment Health. So, let me welcome Dr. Kitulu.
Good morning, everybody. I hope you can hear me very well. And I bring warm greetings from the World Medical Association and from my home country, Kenya. Kenya is in East Africa, and I know some of you have been to Kenya, and I warmly welcome you to Kenya. So I'm bringing you from One Health perspectives, from Nairobi to Fukuoka. And my lecture today is titled Building a Health Secure Future, Integrating Human, Animal, and Environmental Health. So coming from the World Medical Association, the World Medical Association strongly supports the One Health approach, advocating for close collaboration between human, animal, and environmental health. And indeed, the World Veterinary Association, along with the World Medical Association, have focused on improving global health outcomes through integrated multisectoral policies. And there are many aspects of that collaboration between WMA and WVA, including a memorandum of understanding, and of course, the global conference, which was done and signed here in Fukuoka. So it brings me, of course, great pleasure to come back to Fukuoka, where One Health started, and that I am privileged to be presenting this lecture. So as we look at One Health issues, of course, the items that come up in our minds are the land use and change and biodiversity loss, the antimicrobial resistance, or AMR, climate change mitigation and adaptation, zoonotic and reemerging infectious diseases, food safety and security, and chemical pollution. And these are common to all of you who are One Health providers. So looking at the burden, we have 60% of human infectious diseases and 70% of emerging diseases being zoonotic. And this is not only Kenyan data, but also global data. And COVID-19 exposed the devastating impact of zoonotic pandemics. Others that we know of you've heard of, Ebola, rabies, Rift Valley fever, Q fever, influenza, all these actually disrupt health systems and economies. Environmental degradation and climate change, of course, increase disease risk, and specific examples in our country, Kenya, is the spread of diseases such as malaria. Food safety and food security are, of course, under growing threat, and AMR is accelerating across sectors. So the One Health approach starts from way back. It has not just started today. From Hippocrates, and those who are medical know Hippocrates very well, to Rudolf Virchow, to William Osler and Calvin Schwab, the concept of combating zoonotic diseases has consistently emphasized the integration of human health, animal health, and environmental health, which is the One Health approach. So what has been the global response? There has been the quadripartite partnership with the World Health Organization, the Food and Agriculture Organization, the World Organization on Animal Health, and the United Nations Environmental Programme. So those bring large bodies that are looking at One Health and having a partnership. There's the One Health Joint Plan of Action, that's the 2022 to 2026. We are now looking at surveillance and early detection systems. More so after the COVID pandemic, this has become really a highlighted issue. We are looking at elimination of zoonoses like rabies, environmental health integration, climate change adaptation, and the pandemic fund. Now, let me boil down to Kenya. And I'm very delighted that as we discussed yesterday in the meeting with the governor and Dr. Kurauchi, the intention to have the 2028 One Health Global Conference. And in which, and I thought as I speak today, let me bring some parts of the world that you have not heard about. Let me bring Kenya here to Fukuoka and tell you what we are doing in terms of One Health. So come and take this trip with me to Kenya. So Kenya has progressive but evolving advances in disease elimination, pandemic preparedness, food safety, and environmental protection. We had the World Health Organization validation 2025 for elimination of human African trypanosomiasis, which is the sleeping sickness. We've had effective multi-sectoral coordination across health, agriculture, livestock, and environmental ministries. So those ministries coming to work together in the focus of One Health. We've strengthened joint surveillance and rapid outbreak response and implemented a One Health strategic plan 2021 to 2025, which is being renewed. And then there's an urgency to scale up and sustain One Health amid climate and health risks. So these are some things happening in Kenya. Now, in that effort of One Health, my home National Medical Association, that is the Kenya Medical Association, has become a champion for One Health. So KMA champions the One Health approach and aims to be the leading voice on climate change and health. What has KMA done? It has facilitated multi-sectoral collaboration to address zoonosis and to strengthen health security. And World Zoonosis Day commemoration, during which there was an MOU signed between the KMA and the Kenya Veterinary Association, and these two run the first ever physical Kenya One Health conference. This is integrating climate conscious, multidisciplinary strategies in national health dialogue, and we're able even to launch the Kenya launch of the Lancet Countdown 2024 report on health and climate. So KMA is driving awareness and capacity building through World Environmental Day commemoration, World Health Organization webinars on air quality. All these are things that have been ongoing, but KMA is at the forefront of bringing these out to the public. Promoting environmental sustainability within KMA itself, within our own interactions by reducing printing, adopting e-programs, and tree planting initiatives. As we move back to the Kenya One Health Conference, this was a first-time conference. This was held last year on from the 6th to the 7th of November in Nairobi. And the theme was by protecting one, we protect all. So the Kenya Medical Association, in a collaboration with the Kenya Veterinary Association, marked One Health Day. And the aim was to strengthen cross-sectoral collaboration and break disciplinary silos to enhance national and regional health security. The conference received over 105 abstract submissions, mainly from Kenya, Ethiopia, Tanzania, and Zambia. And there was very strong representation from the national and county governments, from partners, from research institutions and universities. This participation demonstrated very well and reinforced the integrated One Health approach. The conference also featured high-level keynote speakers addressing pandemic preparedness, including the establishment of zoonotic disease units. Discussions also highlighted the global threat of AMR and the role of diagnostic stewardship and vaccination as key mitigation strategies. Several sessions explored the nature-based sustainable farming, digitalizing One Health, and the use of large language models to strengthen health systems. These are some pictures from what the conference looked like. This was just a few months ago in Kenya. So the Kenya One Health Conference built strategic partnerships and was aiming at sustainability. And the aim here is to align with established One Health networks and conferences with long-standing experience, such as the Africa One Health University Network, to leverage existing regional and continental platforms to strengthen the One Health agenda. And as I mentioned that point, these conferences, such as where I am today, the 6th One Health Forum, those are some of the continental partnerships that we can build with Africa in terms of strengthening the existing One Health policies. So to engage and experience, to engage new and experienced partners and pursue strategic MOUs to support sustained capacity building. I'm hoping in 2028, KMA and KVA will be part of the conference that you're planning to have here in Japan. And to continue supporting student engagement, research, exchange programs, and academic collaboration in One Health. Indeed, when I was a medical student, we did not learn much about One Health, but we are hoping that in current curricula, in medical schools, in veterinary schools, that we'll have the curricula expand on One Health. So what are some of the future plans for the Kenya One Health Conference? We want to institutionalize that One Health Conference as an annual event in Kenya and expand it to a regional East Africa One Health Conference in this year, 2026. We want to strengthen multi-sectoral collaboration among health, environment, and animal health policy stakeholders, and to scale up the One Health Student Engagement Fund to support more student-led initiatives. Integrating One Health concepts into training, research, and community outreach programs, as well as promoting regional knowledge sharing, innovation, and policy dialogue on One Health. The other highlight I'd bring on environmental health is the Lancet Countdown on Health and Climate Change. And this, the Kenya Medical Association, again, partnered with the Commonwealth Medical Association to launch the Lancet Countdown 2024 report on health and climate, and this was held during the KMA annual President's Dinner. And since 2016, the Lancet Countdown has tracked the links between climate change and health using 50 peer-reviewed indicators. Key focus areas, of course, include heat and health, economic impacts, infectious disease vulnerability, extreme weather events, and air pollution. So those are some of, if you do look online, you'll find some of those presentations on the Lancet Countdown on Health and Climate Change, and the focus being on Kenya, some of them being extreme weather events and health, vulnerability to infectious disease, air pollution, energy transition and health co-benefits, household energy supply, and economic impact of heat. So there are very many aspects, and we are very happy to say that Kenya is participating in this Lancet Countdown of Health, and KMA is actually the focal point in the launching of the same. So what are some key takeaways from this Kenya One Health conference, that it's a call to action for all professions to safeguard health security. That partnerships and collaborations guided by a common goal to address global health challenges strengthen the One Health movement. One Health is key to a healthier, safer, and more productive nation. Some challenges, of course, still remain, and indeed they will be, but I think challenges are there so that we can tackle them. The implementation of One Health approach continues to face some certain drawbacks, that there's a fragmented governance, including challenges arising from devolved systems. In our country, Kenya, we have a national government, and then we also have county governments. So the national policy and the county government policy may vary, and you may find that fragmentation doesn't align very well. But the awareness is increasing, and in the One Health conference we had both national and county governments coming together so that hopefully this fragmentation can be dealt with. There's limited financial and human resources around One Health. There's still been a great dependence on donor-driven initiatives. And of course, right now, I think we are all aware about the major funding changes that have happened across the globe, not just in One Health, but in all sectors, with major donors being from certain countries withdrawing funds. So as this dependence continues to exist, I think diversification is so crucial that each country takes a strong initiative to run its own initiatives without necessarily focusing on donors. The challenge of competing sectoral priorities, particularly in developing countries. There are multiple priorities that all seek funding, that all seek, are all critical to the development of the country. So adding in One Health seems to be just another challenge. But we now realize that without a focus on it and the economic impact of not focusing on it, it is important to place it top in the priorities. So what do we look at as the future of health security in Kenya? Kenya continues to make concerted efforts to build a resilient and secure future for its citizens. There's an urgent need for a national One Health policy supported by sustainable public health financing and the integration of One Health principles across all health professional curricula. Furthermore, strengthened scientific contributions, robust stakeholder engagement, and the institutionalization of One Health within national systems will be critical to advancing and sustaining the One Health approach in the country. So what do I conclude? One Health is a comprehensive framework for health security. I've said this over and over, but I think it is critical that we realize it's a comprehensive framework for health security. The Kenya Medical Association remains a key champion of the One Health approach, providing leadership, convening stakeholders, advancing advocacy, and driving climate, health, and multi-sectoral dialogue nationally and regionally. Integrating One Health across all health professional curricula will strengthen the national preparedness and resilience. One Health is not an option, it is essential for a safer, healthier, and more resilient future. I hope I have been able to take you on a little trip to Nairobi, Kenya, to understand One Health from the perspective of Kenya. So I've brought Nairobi straight here to Fukuoka. Arigato gozaimasu.